eliminate their prescription medications. It's a single medication that covers a lot of different ailments. And so it's kind of off topic, but I just want to remind everyone that this is a very safe drug that covers a lot of very common conditions and treats many conditions at the same time that are real common in our society. And I do think that it's been effective for depression in a lot of our patients. Thank you.
Thank you, Dr. Crocker. I do want to clarify, the motion is still on the table because of all the different types of voting I've got here today. I know there's only two, but bear with me. I just want to make sure everybody's in support. We'll have a vote on the motion that was to discuss by Dr. Lewandowski and seconded by Dr. Crocker. All those in favor say aye. 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 All those opposed say nay. Passes. Okay, and I appreciate that, Dr. Crocker. Is there any additional thoughts? And I would say also that there's a real reason that we all felt that these should be addressed individually. So my sense is that each one of these conditions were deliberated, or at least I can speak for myself, very much individually. So hopefully your predictions don't remain as you stated.
Again, I believe that I fully support Dr. Crocker's clinical experience, but as far as the nature of the petition itself, as a single item identified as depression, not major depression, not depression associated with the use of other conditions or with other conditions such as chronic pain, that I am not supportive based upon the content of the petition submitted.
Okay, is there any further discussion? Okay. Not hearing any, I will entertain a motion to the department that the petition for depression should be approved pursuant to Section 6 of the Act.
So motion.
We have a second?
Second.
Okay. Clerk, will you please call the roll?
Chairperson Dr. Eden Wells,
No.
Dr. David Crocker,
Yes.
Dr. Jeanne Lewandowski,
No.
David Brogren,
Yes.
Dr. Robert Noiva,
No.
Dr. Robert Fabiano.
No.
Chairperson, you have 2 yeses and 4 noes. Motion fails.
Okay, thank you. I will now entertain a motion for recommendation to the department that the petition for depression should be denied pursuant to Section 6 of the Act.
Oh, this is a point of information again. Do we need to do this with each one? Do we need to deny the motion? I see, okay.
Yeah, sorry, that's where I was getting lost with my votes, but procedural importance just to assure that these are addressed and the loops are closed. So I do need someone to make a motion. If not, I'll be glad to make so I so move. Is there a second?
Seconded.
Clerk, will you call the roll?
Chairperson Dr. Eden Wells,
Aye.
Dr. David Crocker,
Can you repeat what we're voting on? I'm sorry.
Sorry, I've moved to recommend to the department that the petition for depression be denied pursuant to Section 6 of the Act.
My answer is no.
Dr. Jeanne Lewandowski,
Yes.
David Brogren,
Yes.
Dr. Robert Noiva,
Yes.
Dr. Robert Fabiano.
Yes.
Chairperson, you have 4 yeses and 2 noes. Motion passes.
Thank you. I now will entertain a motion to discuss obsessive compulsive disorder, which has been brought in as a petition.
So motion.
Is there a second? and I'll just do this. Yes, right. All those in favor for motion to discuss obsessive compulsive disorder, say aye. Aye. All those not in favor, say nay. Any abstentions? None heard. Motion passes. We are open for discussion on obsessive compulsive disorder.
Again, I'll say something briefly with the full expectation that it's not going to pass. I'm just going to consider this educational opportunity. A lot of what we see with cannabis in medicine and why it seems to be so effective is that it seems to create what I would call a distance from the problem, a healthy detachment, if you will. People describe when they take marijuana for pain, kind of as though the pain's been shrunk down and set off to the side. It's just not this big fuzzy ball that's right in the middle of their face. So it's like a meditative distance from the pain. And when you talk to post-traumatic stress patients or people with anger management issues, I'll often describe the same sort of thing, but from a psychological perspective, right? It's like the memories that were so intrusive and so overwhelming that prevented them from ever really dealing with their problems somehow become less threatening and easier to approach and deal with. And I think in the same vein, among our OCD patients, what I'm seeing is that it somehow allows them to detach or put their obsessions at a healthy distance so that they're not so compelling and so torturing. Again, I don't expect it to pass, but I can tell you that I have seen benefit here.
Thank you, Dr. Crocker.
I'd like to comment that some of my similar concerns about the quality of the petition and the information submitted with the petition as supporting documentation, but I do want to identify that there is one good study and reference related to refractory obsessive compulsive disorder and clinical improvement with dronabinol in this submission. And this meets the expectation of supportive peer-reviewed information.
Thank you. Any further discussion? I will need to entertain a motion for the recommendation to the department that the petition for obsessive compulsive disorder should be approved pursuant to the Section 6 of the Act.
So motion.
May I have a second?
Second.
Clerk, will you call the roll?
Chairperson Dr. Eden Wells,
No.
Dr. David Crocker,
Yes.
Dr. Jeanne Lewandowski,
No.
David Brogren,
Yes.
Dr. Robert Noiva,
Yes.
Dr. Robert Fabiano.
Yes.
Chairperson, you have 4 yeses and 2 noes. Motion passes.
Thank you.
I stand corrected.
Right. So it just goes to show that taking individually is yeah. So we don't need to do the additional voting on that. So that saves you any additional second vote. All right. So, sorry, I'm going to take my notes here. Okay, number 4, the 4th petition. I'll move or entertain a motion by anybody on the board here to discuss the petition of panic attacks.
Also move.
Is there a second?
Second, to discuss panic attacks.
Did we not need to do the thing that we did with the others? With OCD, we decided we didn't have to do that anymore. Since it's approved, we don't have to make a recommendation.
It was approved, we didn't have to, that's right, sorry,
make a
so that saved us the second vote,
recommendation.
right. If it wasn't, we'd have to actually,
Motion to make a recommendation.
right. So we have a motion and a second on the table for discussion of panic attacks. All those in favor say aye. Aye. All those not in favor say nay. Any abstentions? None heard? We are open for discussion. Panic attacks.
I think, excuse me, I think, obviously with anxiety not being qualified, panic attacks are a form of anxiety, kind of an extreme form. In my experience, when you're in the middle of a panic attack, there's not a whole lot that's going to help you, including marijuana. I mean, it's time, you just have to weather it and you calm down. I do think that marijuana is helpful for anxiety, for the specific condition of panic attacks, maybe if it was used prophylactically, but not in the middle of a panic attack usually.
I'd move to recommend the department that the petition for panic attacks should be denied pursuant to Section 6.
Yeah, and that's fine, if there's any discussion or if there's a second.
I'll end the discussion and second the motion for denial.
Okay, so we will need to do a roll call. I have a motion on the table to recommend to the department that the petition for panic attacks should be denied pursuant to Section 6 of the Act.
Chairperson, Dr. Eden Wells.
Yes.
Dr. David Crocker.
I'll abstain.
Pass. Dr. Jeanne Lewandowski.
Yes.
David Brogren.
No.
Dr. Robert Noiva.
Yes.
Dr. Robert Fabiano.
Yes.
Chairperson, you have 4 yeses, 1 no, and 1 pass. Motion passes.
Thank you. Yes, we can. Appreciate that. Okay. So the next one, petition on the table. I'd like to hear a motion by my colleagues to discuss schizophrenia by the board.
So motion.
Second.
Discussion is open to discuss schizophrenia. Oh, I need to vote though. I mean, we all need to vote. All those in favor to discuss schizophrenia, please say aye.
Aye.
All those not in favor say nay. Any abstentions? None heard. Motion passes. All right, now we are open to discuss schizophrenia.
Again, I think I'm just going to take this opportunity to make a couple of comments. First off, I don't think that schizophrenia by itself should probably be a qualifying condition. I don't think that marijuana is necessarily a drug of choice for people for the treatment of schizophrenia. I will also say that we tend to take patients with schizophrenia and deny them access to marijuana because of the concerns about it exacerbating their problem. What I can tell you is that in patients that have qualifying conditions and schizophrenia, if they are well managed, and many of them have already had experience with marijuana, they actually tolerate it quite well. And for a lot of people that do get psychotic, it's not a fun place to be. And once you've been there a few times, at least among our patients, they tend to avoid the things that put them in that condition. And I will just tell you that I have treated a handful of patients with schizophrenia that have, with cannabis, and have never had a significant negative outcome that I'm aware of. So I think, I don't think it's a valid qualifying condition personally, but I also think that we should keep our minds open when we're evaluating other patients that have schizophrenia and not use that as an automatic exclusion. Thank you.
Thank you, Dr. Crocker. Any further discussion? Okay. None heard. I will entertain a motion to recommend to the department that the petition for schizophrenia be approved pursuant to Section 6 of the Act.
I'd move to recommend to the department that the petition for schizophrenia should be denied pursuant to Section 6 of the Act.
Second.
We have a motion to deny, to recommend the department petition for schizophrenia be denied pursuant to Section 6 of the Act. Clerk, will you call the roll?
Chairperson Dr. Eden Wells,
No.
Dr. David Crocker,
Voting to deny, yes.
I'm sorry. Yeah, I need to.
yes.
Yes, I'm
Okay.
sorry. These double negatives are going to get us. Okay.
Dr. David Crocker,
Yes.
Dr. Jeanne Lewandowski,
Yes.
David Brogren,
Pass.
Dr. Robert Noiva,
Yes.
Dr. Robert Fabiano.
Yes.
Chairperson, you have 5 yeses, motion passes, and 1 pass. Well, motion passes.
Thank you. Okay, the next condition on the table, I'll entertain a motion for discussion of social anxiety disorder.
I'll put that up.
Okay.
Second.
All right, all those in favor to discuss social anxiety disorder, please say aye.
Aye.
Those not in favor say nay. Any abstentions? None heard. Motion passes. We are open for discussion on social anxiety disorder. And I will, just in my viewpoint, and in my experience, this falls fairly similarly into the class, well, a little bit more specific than that of petition number 1, which is on anxiety. I did not feel that this met kind of the debilitating condition criterion to which we would be weighing marijuana as a treatment.
I'd like to note that I so wish that the petition had more support for the use of marijuana in this condition, but it is not there.
Streamline things. Is there any further discussion on social anxiety disorder? All right, I will just, I'm going to streamline things a little bit. Will entertain any motion to the department for the petition to recommend or to approve or deny the petition on social anxiety disorder pursuant to Section 6 of the Act.
Approve or deny?
Either one. You can make that motion. I'm just entertaining a motion.
To approve.
Is there a second?
Second.
I have a motion on the table to recommend to the department that the petition for social anxiety disorder be approved pursuant to Section 6 of the Act. Clerk, can you call the roll?
Chairperson Dr. Eden Wells,
No.
Dr. David Crocker,
Yes.
Dr. Jeanne Lewandowski,
No.
David Brogren,
Yes.
Dr. Robert Novia,
No.
Dr. Robert Fabiano.
No.
Chairperson, you have 2 yeses and 4 noes. Motion fails.
I'd like to move that the petition for social anxiety disorder be denied recommendation to the department for inclusion in qualifying conditions.
All right, is there a second? Okay. I'll second that motion, Dr. Lewandowski. Okay, I have a motion to recommend to the department that the petition for social anxiety disorder be denied pursuant to Section 6 of the Act. Clerk, could you call the roll?
Chairperson Dr. Eden Wells,
Yes.
Dr. David Crocker,
No.
Dr. Jeanne Lewandowski,
Yes.
David Brogren,
No.
Dr. Robert Noiva,
Yes.
Dr. Robert Fabiano.
Yes.
Chairperson, you have 4 yeses and 2 noes. Motion passes.
Thank you. Very good. What I'd like to do is now entertain a motion for the discussion of arthritis.
So motion.
Second.
Motion and a second. All those in favor of discussing arthritis petition, please say aye. Aye. All those not in favor say nay. Any abstentions? None heard. Motion passes. We are open for discussion.
I mean, I personally think this is kind of a little bit of a confusing one. I mean, arthritis to some degree falls within the existing qualifying condition of severe chronic pain, if it is severe and chronic. And I think we're going to discuss the non-severe, non-chronic pain later. I do feel that arthritis is effectively treated with cannabis in a lot of our patients. For some it's the best medication. I don't think that it needs to be severe in order for you to benefit safely from cannabis. I think, a lot of the cannabinoids are demonstrating some good anti-inflammatory properties, which may slow the progression of the disease in theory. And certainly as far as relief, better sleep, more comfortable activity and so forth, I see that every day. So I'm in favor of arthritis, despite the fact that I think it might be included in some of the other conditions we'll be voting on.
Thank you. Is there any further discussion?
I too did not understand why this was necessary to add. I don't think that there is any evidence within the supporting documents in the petition that there is a role for cannabis specifically in the anti-inflammatory effect on joint destruction associated with arthritic conditions. I think that there is significant evidence related to some of the information that Dr. Crocker spoke to, and I'm not sure that tissue studies without any human trials are appropriate for submission with any of these petitions. Either in the animal model, or I don't even think these are human tissue. These are animal model studies. So although there is hope and for future benefit or proven future benefit, I would hope that chronic pain would be enough of a qualifying condition that any arthritic sufferer could receive certification for qualification for qualifying debilitating condition without the need to add this as a specific diagnostic area.
I don't disagree with Dr. Lewandowski on that point, except for one little detail. We see over and over again within the courts, but the prosecutors and the judges not liking the phrase chronic pain as the reason that someone uses marijuana. They reject it oftentimes. So when you have a specific category like arthritis, it is helpful to have that specified. More is better than less.
I think that would require then better legal representation
By the prosecutors, you mean?
to clarify what the law is.
Can I get a clarification on just that point? It's my understanding that the law says that it's about, that it can be about treating the symptoms of the debilitating illness. It doesn't necessarily have to treat the etiology of the disease. Is that true?
That's my understanding.
Yeah, it says essentially in section 2A, in the findings that discover beneficial use of marijuana in treating or alleviating the pain, nausea, and other symptoms associated with a variety of debilitating medical conditions. So, I don't know if you have the additional part in the actual.
Yeah, no, that's correct. I think part of the certification is that the physician, when they review the conditions, decide whether they receive therapeutic or palliative benefit for the use of marijuana to treat and alleviate the patient's debilitating condition. That's part of the written certification part. Is that helpful?
Yeah, okay, thank you. I'll just speak in general, this may be similar to a couple of the other earlier petitions in that arthritis, essentially break it down as inflammation of a joint, very general term, and covers an extremely broad array of medical conditions. And so I think perhaps the petition was a bit hurt from its non-specificity. Is there any further discussion? Okay. I'll entertain a motion for the petition to either be approved or denied pursuant to Section 6.
Motion to approve.
Second.
And there's a second? Okay. All right, I have a motion to approve the petition for arthritis pursuant to the department pursuant to Section 6 of the Act. Clerk, can you call the roll?
Chairperson Dr. Eden Wells,
No.
Dr. David Crocker,
Yes.
Dr. Jeanne Lewandowski,
No.
David Brogren,
Yes.
Dr. Robert Noiva,
Yes.
Dr. Robert Fabiano.
Yes.
Chairperson, you have 4 yeses and 2 noes. Motion passes.
Okay. Thank you all. Moving on. And by the way, is it for the panel, if anybody needs to take a break at some point, obviously please make a motion to do so. I don't want to compromise anybody's health while you're here on the panel. All right. The next condition to be brought for discussion, I'll entertain a motion to discuss rheumatoid arthritis. I can make that motion if there's a second.
Second.
Okay. All those in favor to discuss rheumatoid arthritis, please say aye. Aye. All those not in favor, please say nay. Any abstentions? None heard. Motion carries. Any discussion? I'll just make a statement just to follow up on the 7th petition here. And number 8 is that I felt that this addresses the specificity that perhaps I was looking for in terms of the petition.
My comments would be the same as for the last condition.
And I guess I would have a point of clarification that the exact same information was submitted for both petitions. And the information that is supportive of the use in the treatment of rheumatic arthritis comes from an animal model, tissue-based information. The additional supporting documentation talks about the adverse effects of other treatments, not the benefit of marijuana for the treatment of rheumatoid arthritis. The diagnosis of rheumatoid arthritis is certainly much more specific, but there is not information that is supportive. It is, again, the anti-inflammatory properties of cannabis in the form of dronabinol in a tissue model.
Thank you, good points. Any other discussion? Okay, I'll entertain a motion for approval or denial to the department for the condition of rheumatoid arthritis.
Motion to approve.
Second.
Okay, we have a motion on the table for the approval of rheumatoid arthritis, recommending to the department that the petition be approved pursuant to Section 6 of the Act. Clerk, can you please call the roll?
Chairperson Dr. Eden Wells,
Yes.
Dr. David Crocker,
Yes.
Dr. Jeanne Lewandowski,
No.
David Brogren,
Yes.
Dr. Robert Noiva,
Yes.
Dr. Robert Fabiano.
Yes.
Chairperson, you have 5 yeses and 1 no. Motion passes.
Thank you. Okay. Condition number 9, like to move for discussion, and I'm just making the motion here, so I can just it up here a little bit. Next condition to discuss would be brain injury.
Second.
All those in favor to discuss brain injury petition to the board? Okay, and all those opposed say nay. Any abstentions? None heard, motion carries. We are open for discussion on brain injury.
Well, I'll talk about the fact that I think that the term is far too broad a term. If it is truly brain injury, if it's traumatic brain injury, that is a completely different term. There are hypoxic, metabolic, there are many other forms of brain injury. There is individual tissue damage at the cellular level, there is vascular damage, there is deformity, there is regressive illness, there is progressive neuromuscular illness that is central in a brain injured individual. There are congenital malformations, there's many other forms. So to me, the term brain injury is way too broad a term to be included. The supporting documentation related to post-concussive syndrome may be beneficial, but the petition, as stated, is too broad.
Thank you. Any further discussion?
Yeah, can I get a point of information? Do we have traumatic brain injury as a current condition?
We do not. So it is a broad category, and I can see where certain types of brain injury, if they were real minor, or if there was nothing, if the injury was completed and there was no residual deficit, where marijuana might not be indicated. But in general, the U.S. government has a patent on THC for its neuroprotective effects, and that is one of the things that we, most of us in the scientific community can agree on, is that it does have some neuroprotective effects. And in people who have had strokes, and people that have brain tumors or have had major brain surgery, apart from the fact that they often have seizures and headaches and things like that, often have agitation. We use marijuana for the agitation of Alzheimer's disease. They often get anxiety. And I do, in my experience, I've seen many patients with brain and spinal cord injuries, and they rely on marijuana quite specifically. There's no other medication that does for them what marijuana does. So I'm going to be very much in favor of this condition.
Yes, Dr. Fabiano.
So I would, my rebuttal to Dr. Crocker would be in having treated patients with traumatic brain injuries now for going on 37 years. Some of the primary side effects of marijuana would be concerning with regards to traumatic brain injury, direct effects adversely on the working memory system, memory retention. And my concern as well would be in terms of the degree of inactivity that is often a major struggle in the rehabilitation with patients with traumatic brain injury, and concerned about the side effects of marijuana further exacerbating that depth of inactivity and the ability to engage in productive activity and behavior.
I can't argue with that at all. Obviously, you're very much the expert on the subject in the room here, and I can only rely on my personal experience and judgment on this. And I think it's important, this is a good case where it's important to remember that just by allowing marijuana to be used for brain injuries or by voting in favor of it, we're not saying that everyone with a brain injury has access to marijuana. That's a decision that's made between the patient and their physician. So it's not as though everyone with any kind of brain injury is suddenly going to be able to rush out and get marijuana. Although in November of this year, we probably will be voting on legalization for recreational use, and it probably will pass, which may make a lot of what we're doing today moot. But again, what I would remind the panel is that just making available marijuana for brain injury patients doesn't mean that every patient gets access to it.
And I guess I would remind the panel that we're supposed to take the petition based upon the content of the petition and the information that was submitted. And I believe that is our role. I am, a stickler with this particular issue. And this is, brain injury is not even a chapter in a textbook. And so I think someone has to be very specific about traumatic brain injury, as opposed to what I'm talking about in hypoxic or metabolic encephalopathies, which are also forms of brain injury. And there's no supporting data that has been submitted with this petition that shows benefit of the use of medical marijuana for treatment of brain injury.
Any further discussion? That's it. I'll move for a recommendation to the department for either acceptance or denial of the petition for brain injury pursuant to Section 6.
I'll recommend acceptance.
Second.
We have a motion for approval to the department for the petition for brain injury that should be approved pursuant to Section 6 of the Act. Clerk, could you call the roll?
Chairperson, Dr. Eden Wells.
No.
Dr. David Crocker.
Yes.
Dr. Jeanne Lewandowski.
No.
David Brogren.
Yes.
Dr. Robert Noiva.
No.
Dr. Robert Fabiano.
No.
Chairperson, you have 2 yeses and 4 noes. Motion fails.
We'll now need to, I need a motion to be made to deny the petition for brain injury to the department and to be denied pursuant to Section 6 of the Act. Is there a motion?
I will move to deny this petition.
I'll second. Very good. We have the motion now on the table. The recommendation to the department will be that the petition for brain injury should be denied pursuant to Section 6 of the Act. Clerk, can you call the roll?
Chairperson, Dr. Eden Wells.
Yes.
Dr. David Crocker.
No.
Dr. Jeanne Lewandowski.
Yes.
David Brogren.
No.
Dr. Robert Noiva.
Yes.
Dr. Robert Fabiano.
Yes.
Chairperson, you have 4 yeses and 2 noes. Motion passes.
Very good. The next petition, similar, is I'll go ahead and make the motion to discuss the condition of spinal cord injury, which has been brought to the medical marijuana review panel. Is there a second?
Second.
All those in favor to discuss spinal cord injury, please say aye. Aye. All those not in favor say nay. Any abstentions? None heard, motion carries. We're open for discussion on spinal cord injury.
I would recommend that the petitioner understand that chronic traumatic encephalopathy is not a spinal cord injury. There are spinal cord injuries that are associated with that, but they are not in and of the same. And post-concussive syndrome is a central, not spinal cord condition. And that the data that was submitted supportive of a spinal cord injury is central and not peripheral in nature.
Yeah, and I'll just speak on that, is that I found that the petition seemed more supportive of the previous condition of brain injury.
And again, philosophically, obviously, there's a difference as far as what we think needs to be evaluated here. But I do think the spinal cord injury, I have a lot of spinal cord patients in our practice. A lot of what they suffer from is already covered in the qualifying condition list, whether it's muscle spasm or pain. I am in favor of making marijuana available to spinal cord injury patients. Whether or not making it available as a specific condition is going to increase their access, I'm not certain. But I'm willing to err on the side of caution to make sure that they do get access, so I am in favor of this.
Thank you. Any further discussion? All right, I'll entertain a motion for approval or denial of the petition.
Motion to approve.
Second.
There's a second. Okay, on the table we have a motion to recommend to the department that the petition for spinal cord injury be approved pursuant to Section 6 of the Medical Marijuana Act. Clerk, can you call the roll?
Chairperson Dr. Eden Wells,
No.
Dr. David Crocker,
Yes.
Dr. Jeanne Lewandowski,
No.
David Brogren,
Yes.
Dr. Robert Noiva,
Yes.
Dr. Robert Fabiano.
Yes.
Chairperson, you have 4 yeses and 2 noes. Motion passes.
Okay, thank you. Sorry, just give me a second. Okay, make a motion to open discussion on a petition number 11, which is asthma. Anybody dare to second?
So motion second.
All those in favor of discussing asthma, please say aye.
Aye.
All those opposed say no. Any abstentions? None heard, motion carries. We are open for discussion on asthma.
I personally have a little concern about this one. I think we do know that THC is a bronchodilator, and I can't tell you how many patients come to our office saying, gosh, I get up in the morning and I smoke me some marijuana and it clears my lungs out and it gets me ready for the day. And most of them have a pack of cigarettes in their pocket, and not all of them, okay? I'm just saying that I see too often among our patients where it's not just with cannabis, but also with their inhalers, where people continue to use cigarettes and the things that cause their underlying condition and then try to treat the symptoms with their inhalers or their cannabis or what have you. And it's really a nasty trap to get into. Because once you get to the point where, you know, you're smoking and the inhalers don't work, you're pretty much screwed, for lack of a better word, right? You're on oxygen, you don't have much of a life. So I think, you know, despite the fact that I have seen people that seem to really appreciate cannabis for their asthma, some for the pain, chest pain that they get with asthma, and despite the fact there are inhalers now and edibles, I cannot really fully get behind asthma as a qualifying condition. Thank you.
Thank you for that. Any further discussion?
I'd move to recommend the department that the petition for asthma should be denied pursuant to sections.
Second.
Okay. I have a motion to recommend to the department that the petition for asthma be denied pursuant to Section 6 of the Act. Clerk, could you call the roll?
Chairperson Dr. Eden Wells,
No. I mean, yes.
Dr. David Crocker,
Yes.
Dr. Jeanne Lewandowski,
Yes.
David Brogren,
Pass.
Dr. Robert Noiva,
Yes.
Dr. Robert Fabiano.
Yes.
Chairperson, you have 5 yeses and 1 pass. Motion passes.
Thank you. All right, entertain a motion to discuss diabetes. I'll make it.
Moved.
Second.
All right. All those in favor to discuss diabetes, please say aye. All those not in favor or opposed, say no or nay. Any abstentions? None heard, motion carries. We're open for discussion for diabetes.
This is a complicated one. It's, obviously among chronically disabled patients, a large number of those patients are diabetic. And a large number of those patients suffer from some of the other qualifying conditions that are on the list. And I think as a whole aren't, as a result, often denied access the way the program stands. There's been some recent literature coming out about how cannabis might improve insulin response, and that people that have used cannabis throughout their lives actually have a lower incidence of diabetes than people that don't. That scientific information is somewhat soft, but it's also very encouraging. We see patients that come in with diabetes on a regular basis. Obviously, many of those patients already have neuropathy or severe nausea from gastroparesis. We don't get a lot of healthy diabetics, right, that come in looking for cannabis to help control their blood sugars. And frankly, I just don't know how well it does it. I do know that our diabetic patients, when they use cannabis, tend to get better control over their blood sugars as long as they're not overeating with it. The data's a little soft right now, in my opinion, for this one. I hold out very high hopes, actually, that some of the cannabinoids might help to manage diabetes. But at this point, I just don't have enough information.
I would assume that the intention, based upon some of the supporting information, had to do with the severity and the chronicity of diabetic insult on the body, particularly the neuropathies, and the symptoms associated with neuropathy, for which those are already qualifying conditions. It would be difficult for me to imagine a diabetic with significant neuropathy who would not have the ability to be supported in the use of medical marijuana. So I do not think that the condition as a whole, nor the information that was presented in the petition, is enough to support this petition.
I have a question directed to Dr. Crocker and other colleagues. Perhaps one of the more robust therapeutic effects of marijuana, at least from my understanding, is appetite enhancement.
Mm-hmm.
That would be a concern I would have with regards to diabetes in terms of weight management. Could you respond to that?
I would love to, actually. You would think that everyone that used marijuana would gain weight, but they don't. What we see is that a lot of patients, yes, the munchies are a well-known side effect of marijuana, and you certainly, if you sit around with a pack of Twinkies and roll a joint, you're probably going to eat the whole pack. But among our overweight patients who come in and start using marijuana, many actually lose weight. And part of it is because their mood is improved. People often eat for mood issues. Part of it is because they're able to be more active without worrying about being laid up in bed for a couple of days afterward. And so, despite the fact that we know it does increase appetite, I think it's not that cut and dried. I think there's a lot of benefits that can come to people in terms of increased activity and improved mood and generally improved quality of life, which is ultimately what we're looking for. I think a lot of people overeat because they're unhappy and because they're uncomfortable. And I think in that situation, it does tend to help. But I agree with you. I'm just meandering right now. I don't have any solid rebuttal to that, other than I think it's not black and white.
And I would state that the petition is not for satiety. It is for diabetes. And it's not diabetes type 1 or type 2. It is diabetes.
I move to recommend that the department deny the petition for diabetes pursuant to section 6.
Second.
Motion's on the table to recommend to the department that the petition for diabetes be denied pursuant to section 6 of the act. Clerk, could you call the roll?
Chairperson Dr. Eden Wells?
No. Yes.
Okay.
Boy.
Dr. David Crocker?
Pass.
Dr. Jeanne Lewandowski?
Yes.
David Brogren?
Pass.
Dr. Robert Noiva?
Yes.
Dr. Robert Fabiano?
Yes.
Chairperson, you have 4 yeses and 2 passes. Motion passes.
Okay, thank you. All right, and this brings up a group of diseases that are fairly similar. We're going to go into, I'll make a motion to discuss the 13th petition, which is colitis.
Second.
All those in favor to discuss colitis, say aye.
Aye.
Aye. All those not in favor or opposed, say nay. Any abstentions? None heard. Motion passes. We're open for discussion. I just wanted to make note that I think perhaps for those, not medically savvy, that there was some conflation with a number of these next petitions, and that I think the petitioner, it was confusing to me whether we were focusing on ulcerative colitis, which is a definite pathologic disease, versus a colitis in general, which just means inflammation of the colon. So this is just where I had some difficulty knowing that there's a couple other conditions on the list today. So I just wanted to make a point that I had to keep going back and rechecking exactly what the petitioner was requesting.
So I agree with the fact that there's a lot of overlap here. And again, for the non-medical professionals, inflammatory bowel disease includes ulcerative colitis. Colitis includes inflammatory bowel disease and ulcerative colitis. Gastric ulcer is a different area of the body, but in general, we know that our Crohn's patients respond quite well to cannabis. And that is also one of the inflammatory bowel diseases. I have a number of ulcerative colitis patients that also respond quite well to cannabis. Whether we want to include generalized colitis, that's questionable. You can have if you get gastroenteritis, you can get colitis. It's gone in 2 days, right? One of the things, some of the things that we see in our GI patients with cannabis, number one is we know that THC relaxes smooth muscle, so that crampy abdominal pain and diarrhea and poor absorption that comes from not really having it in your system very long tend to be mitigated somewhat by marijuana, and it's very rapid in its effect. People that have that severe crampy abdominal pain can use marijuana in a vapor form and get almost immediate relief from it. So again, with this spectrum of diseases, I think that marijuana is quite effective, or can be quite effective. And so I'm in favor of using marijuana. For me, the main confusion is about, do we really need colitis as a separate entity, or as an entity? Maybe. I mean, it's general enough to incorporate some things that might not already be included. So I'm not sure on that one. I'll have to think about it, but I do think in general that cannabis is quite effective for this type of condition.
So I appreciate your comments, and I think there's some valid points. I think speaking from the public health and the internal medicine perspective, colitis to me very often I certainly consider the inflammatory bowel disorders, and you'll see in my responses in the 15th and 16th petitions accordingly how I respond. But colitis to me will always mean that I have to rule out infection first. And so to me it is a very, very broad category. Again, you've heard me say this a couple times. So that's pretty much where I'm going, but I don't have a disagreement with your points regarding some of the utility.
Can I get information? Currently, we have ulcerative colitis as a
So we have Crohn's disease.
Crohn's disease is on, but ulcerative colitis was not.
As a current qualifying condition, you mean?
Yeah.
Yeah, ulcerative colitis is not a current qualifying condition.
But I'll clarify Crohn's, I believe I did.
Crohn's
See it.
disease.
Yes, okay. Yeah.
And I, just because we're discussing this particular one, if you need to look at the agenda, because there are more category-specific petitions coming.
Right. Any further discussion? Would anybody like to make a motion to approve or deny a recommendation to the department on this petition? Okay. I will, nobody's, oh, I'm sorry. You take that?
Go ahead.
Okay. I would like to make a move to the department that the petition for colitis be denied pursuant to Section 6 of the Act.
Second.
The motion on the table is to recommend to the department that the petition for colitis be denied pursuant to Section 6 of the Act. Clerk, could you call the roll?
Chairperson Dr. Eden Wells,
Yes.
Dr. David Crocker,
Pass.
Dr. Jeanne Lewandowski,
Yes.
David Brogren,
No.
Dr. Robert Noiva,
Yes.
Dr. Robert Fabiano.
Pass.
Chairperson, you have 3 yeses, 1 no, and 2 passes. Motion fails.
Okay.
As a point of information, why does this motion fail? Do you need a strict majority, or do you need a majority of the votes?
You need a majority of those present.
Right.
So there's 6, and so we need 4.
Right. Right. So what we would do now is then entertain a motion to recommend.
Go the opposite way with it.
Go.
Yeah, go the opposite way and see what happens.
Right. So would anybody like to make a recommendation to the department for approval of colitis?
So motion.
Second.
Okay. The motion on the table is to recommend to the department that the petition for colitis be approved pursuant to Section 6 of the Act. Clerk, could you call the roll?
Chairperson Dr. Eden Wells,
No.
Dr. David Crocker,
Yes.
Dr. Jeanne Lewandowski,
No.
David Brogren,
Yes.
Dr. Robert Noiva,
No.
Dr. Robert Fabiano.
Yes.
Chairperson, you have 3 yeses and 3 noes. Motion fails.
Yeah. Yeah, I'll entertain a motion that we table this particular condition given the discussions. And again, well, I'll just entertain a motion first and then we can discuss later. Is there a motion to table this? Perhaps we may receive an additional panel member this morning.
So motion.
Your second?
Second.
Okay. All those in favor of tabling the condition of colitis for the current, time being, say aye. Aye. All those not in favor say nay.
Nay.
Hang on, what happened?
Okay, we got two. Oh, I'll be
I'll do.
Clerk, could you do a roll call?
Chairperson, Dr. Eden Wells,
Yes, for table.
Dr. David Crocker,
Yes.
Dr. Jeanne Lewandowski,
No.
David Brogren,
Pass.
Dr. Robert Noiva,
Yes.
Dr. Robert Fabiano.
Yes.
Chairperson, you have 4 yeses, 1 no, and 1 pass. Motion passes.
All right, so the motion for, the petition for colitis will be tabled at this point in time, and, as a vote stays, currently a tie. Yeah, and I'll entertain a motion if anybody need a break at this point, or do you choose it is now 10:24 by the clock on the back of the wall? Or would you like to?
I'll move to, break.
Okay, is there a second? All right, all those in favor to break, say aye. Aye. All those not in favor, say nay. No abstentions? Okay.